Hi, I'm Dr. Brian Thornburg, and we had a little minor burn in the house last night. We were cooking and a hand got burned next to the stove. And so I thought this would be an excellent time to discuss what you can do at home to help the pain, reduce the inflammation, and how to recover if you have a minor burn. This is not for a third-degree burn or a second-degree burn across an essential area. An essential area would be across a joint line because you want to make sure there's plenty of elasticity at the joint line. So if there's a burn over that area, second or third degree, you want to seek medical attention because you want to make sure that heals correctly so you don't lose any of the mobility of a joint. Also, obviously, if you have a burn on the face, around the eyes, in a sensitive body part area, you want to seek medical attention to make sure that the appropriate treatment is being performed. So this is for a first, second, and a very small third-degree burn in a non-essential area. So as soon as the burn happens, you want to give Motrin. Motrin, ibuprofen helps stop the inflammation cascade because when there is inflammation, you release cytokines, you release prostaglandins, and Motrin helps stop that. So what we do is we reduce the amount of inflammation that will occur at the tissue. Additionally, you want to apply ice, and this can be tricky. This is the tricky part with kids because obviously they don't want to just have ice applied to their arm or leg, especially once the ice starts to feel a little bit uncomfortable. But this is, I think, probably more important than the Motrin. You have to apply ice as much as possible for the next 4 to 6 hours because what the ice does is one, it helps pull the heat out of the tissue as fast as possible. So that helps reduce any heat-related damage to the tissue. And then the ice will reduce the blood flow to the area. So you're not going to deliver as much fluid. So there's not going to be as much swelling. The reduced amount of fluid means that the inflammatory markers that will come because of the injury are also reduced. There's just a decreased delivery of inflammation. So now we have the Motrin working along with the ice, helping reduce any heat-related injuries to the tissue, also reducing that cascade of inflammation that can happen or does happen with burns. And then now let's discuss what to do after the burn. You want to apply aloe vera. You do that 2 to 3 times a day. I like fresh aloe vera if you can find it. It's good to keep a little plant by the window. They love direct light. They're super easy to keep. Also, you can apply Manuka honey. You put a thin film of Manuka honey on the burn. You do that once, twice a day, depending on what healing stage. You can use other honeys, but Manuka honey has the best anti-inflammatory products. If you can get the ones from New Zealand, that is most preferable because they have the cleanest weather patterns. The honey is going to be the purest. This also goes as a side note for meat. If you can get milk, cheese, lamb, beef from New Zealand, that's going to be your highest quality. You want to put Manuka honey down twice a day, cover the area. Once the wound is no longer open, then you can do vitamin E oil. You want to make sure you're taking plenty of zinc. You want to take fish oil, vitamin D, and just maintain some protection over the area for 3 to 6 months because that burned skin does not contain the adequate number of melanocytes, which help protect us from scarring. And so when we're out in the sun and there is a decreased number of melanocytes and the area is not protected with sunscreen or a hat, then you can increase the risk of scarring. Thank you very much.